Hello, and thank you for joining me for today's webinar that's brought to you by Health Risk Screening Incorporated and Anchor. It's called Breakthroughs in Clinician Education in IDD Healthcare, How You Can Help. Let's get started. During a consultation with an ER physician, the doctor stated that people like my patient aren't meant to live that long and have no quality of life. Physician uncomfortable with treating individuals with IDD, either appeared scared or annoyed. They don't listen to the nurse or direct support provider that knows the client. I've had a number of physicians, instead of treating our individuals, recommend hospice because of a poor quality of life. I had a doctor totally ignore what I was saying and started the individual on psych meds. These are all comments from nurses who have worked in the field of healthcare for people with IDD about experiences they've had with physicians. Unfortunately, that is the standard. That is what many people with IDD and their supporters face when accessing the healthcare system. My name is Craig Escude. I'm a family physician. I'm a fellow of the American Academy of Family Physicians and the American Academy of Developmental Medicine. I've practiced in the field of healthcare for people with intellectual and developmental disabilities for well over 20 years, providing healthcare to people with serious levels of disabilities as well as complex mental and medical health conditions. Today, I'm going to introduce to you two new resources that are available to help improve the current situation regarding education of clinicians in this field. Let's fantasize for a moment. What if people with IDD could access capable, competent, and compassionate healthcare anywhere they went? What if they could walk into any office, any medical practice, and receive good, appropriate, compassionate medical care from clinicians who understood their needs? Wouldn't that be great? Here are the facts. People with IDD face health disparities compared to people without IDD. We know that they have higher rates of chronic conditions like obesity, diabetes, cardiovascular disease, and arthritis, and lower rates of preventative screenings like for breast cancer, cervical cancer, and colon cancer. People with IDD overall have a lower life expectancy than their counterparts without IDD. We know that people who are more significantly affected by their disability have greater disparities in their age of death. And I can tell you from personal experience, my own experience, that there are numerous incorrect assumptions and stereotypes about people with disabilities that are made by healthcare providers. Unfortunately, many years ago, I was one of those. Physicians report a lack of experience with the IDD population and a lack of training, and this is self-reported. Physicians recognize that they don't have the training in this field of medicine. Medical students who don't receive the training, it's been shown in studies that they exhibit overall poorer performance providing healthcare for people with disabilities, including in simple things like even taking a medical history or conducting a physical exam or ordering laboratory tests. There is some good news, though. There's evidence that when people have experience and training early on in their careers, that they do better, that their attitudes about disabilities improve, and they have an increased comfort level in providing care for people with disabilities. You know, we know that healthcare providers receive little training in IDD healthcare. They're often unaware of related physical and medical concerns. And this is a big one here. They're often unaware of the relationship between behavioral issues and health issues. They also have little information or not enough information on people with very complex conditions. You know, the point about behavioral issues being related to health issues, I can again speak to that from my own personal experience. That's not something I knew when I started in this field, and it is such an important component of providing good health care for people with disabilities that is not there in a lot of instances. There are challenges to providing healthcare education to clinicians. One of them is we need to identify who needs it the most. Of course, all clinicians need education and training in this field, and that's the ultimate goal. But what we want to do is really target it to the clinicians who are seeing people with disabilities the most. So we need to figure out how do we identify who is seeing people with disabilities. We also know that physicians like to learn from other physicians, and this to some degree is understandable. We all want to learn from people that are maybe at least at our level or have more experience than us. Think about a college course. You'd probably rather have a professor teach you than a grad student, or surgical skills. You probably would rather learn them from the surgeon rather than a surgery tech. Or if you're going to take piano lessons, you want someone who's well trained in piano and not a novice to teach you how to play the piano. When we look at healthcare provider training, we know that medical school education in IDD healthcare varies greatly. It usually depends on the presence of a champion, meaning someone who has an interest in this field, who has experience, and also sees the importance of teaching it to their students. There are currently no national expectations on training in IDD healthcare. There are groups that are working on this, including the American Academy of Developmental Medicine and Dentistry, and others who are working to create and provide a framework for training all students in IDD healthcare. Not only in medical schools is there a lack of training, but also in primary care residencies as well. But people with IDD look to family practice doctors. They look to general medicine providers and nurse practitioners and physician's assistants for their continuing and their comprehensive health care. So what does this mean? It means that many people with significant medical issues are seeking health care from clinicians who have little training or experience in the field. Let's talk about Mary. Mary was a lady who we supported in her residential program, and she became ill with fever and shortness of breath and had a significant case of pneumonia. She was transferred to the local hospital for treatment. And a few days later, we received word that Mary had been started on hospice. So we checked in on her and had made a call to her physician, and her physician said that she had done well with the pneumonia treatment. She was off oxygen, breathing on her own, wasn't running fever anymore, but she wasn't eating. And nothing they tried, she just wouldn't eat anything. So we kindly thanked them for their care and asked that she be transferred back home. And when she got home, she was found to be pretty significantly constipated. We relieved that, and with her being back in her home environment, she ate well and returned to her usual pleasant, happy self. This problem is not going to disappear on its own. We've got to act to solve this problem. What are some components of a successful solution to educate clinicians? Let's talk about that for a minute. The process needs to be time efficient. It needs to be delivered very efficiently and be able to be quickly digested and implemented. It needs to be practical information that's immediately usable, that they can apply right away to people that they're seeing. It needs to be pertinent to IDD health-related issues. It doesn't need to be comprehensive. And what I mean by that is clinicians understand these disease processes. They understand what constipation is and how to treat it. They understand what aspiration is and how to treat that. But what's missing is the context of how these different conditions can look different in people with disabilities, how they may be more frequent, how certain behaviors can indicate that these other conditions might be going on. And then also the information needs to be able to reach the target audience. And I'm going to touch a little bit more about that later on in the presentation. I want you to think about this. When we educate clinicians, we save lives. When we educate clinicians, we reduce suffering and we can improve the quality of life of people that we support. So now let's talk about some solutions to clinician education that you can use, that you can provide access to the clinicians that are seeing people that you support. And these solutions are called the curriculum in IDD Healthcare and the clinical pearls in IDD Healthcare. Let's start by talking about the curriculum in IDD Healthcare. The curriculum is an online interactive e-learn course that really is meant to teach the fundamentals of healthcare for people with intellectual and developmental disabilities. It's written and delivered by a doctor for doctors and other healthcare providers. There are 6 modules in the curriculum. They're interactive. There are knowledge checks and a post-test as well that's included in the curriculum. When clinicians complete the curriculum, they can receive both continuing medical education credits for physicians, and for nurses, it's also approved for continuing education units. So here's a list of the 6 modules in the course, and I'll tell you a little bit about each one of them. So the first one is IDD Healthcare, Then, Now, and Next. This is where we kind of look at the overall system of supports and healthcare for people with disabilities. What was it like years ago? Where are we now? And where are we moving towards? And where should we be moving towards in this field? The second module is Healthcare Basics in IDD. This one is a very clinical module. This is where we talk about the Fatal 5, things like seizures and sepsis and dehydration and constipation, bowel obstruction, spasticity, hypertonicity. We cover osteoporosis. We cover some general lab considerations. Also covering some dental issues. We even talk about wheelchairs and some of the different types of wheelchairs and different types of physical supports for people who utilize wheelchairs. So again, a very clinically oriented topic filled with information that's very practical. The third module is really my favorite, common behavioral presentations of medical conditions. This was such an eye-opener for me as I learned these things throughout the years. And so there are a number of case studies that illustrate how these behaviors that people are having were really pointing to very specific underlying health conditions. The fourth module is dual diagnosis in IDD. We know that in this field, when we say dual diagnosis, we're talking about someone with an intellectual or developmental disability and a co-occurring mental health condition. So in this talk discusses the complexities of diagnosing a mental health condition. It is very difficult. It can be very challenging. So there's some specific tips that are given that will aid a person in coming up with the correct diagnosis. Also, this module discusses polypharmacy and good prescribing habits to help reduce the number of medications that people are on. The fifth module is effective communication. We know that there is a communication gap between clinicians and people with disabilities and their supporters. It's something that can definitely be improved, though. So the module covers information that will help clinicians have a better understanding of the support network, of the types of people that are involved in supporting people with disabilities, how to get information that they need to get a better diagnosis, and how to provide good information to people who support people with disabilities so that they can utilize it and take it back to others on the team. So it's all about communication and each group getting the type of information that they need to better support that person's health. And then the sixth module is case studies in IDD healthcare. Clinicians love case studies. It's one of my favorite ways to learn things. So this is all case studies that really tie together all of the different all of the different topics that are presented in the other modules. Here are a couple of screenshots from the course. So this one is on the Olmsted decision, and this is in the first module, and it talks about what the Olmsted decision is and why more people are moving into community settings. This one is from the second module, Healthcare Basics, and this is on bowel obstruction, and it talks about the importance of understanding it, recognizing it, and goes into more detail about how it can present and look differently in people with disabilities. This one is from the fourth module. This is on dual diagnosis. This is the beginning slide where we start talking about psychotropic medications, some of the complications, and some basic principles and good prescribing habits for these drugs. And here's one from the final module, the case studies module. This is about Sheila. She has a moderate intellectual disability, but she's very fidgety. She can't sit still. She's putting her hands in her pants. She gets upset when she goes to the bathroom. So this asks the question and answers the question as to what might be going on with Sheila. So what kind of feedback have we gotten so far? So for clinicians out in practice that have used this course, here are a few quotes from some of them. This course should be mandatory for all medical students, would also benefit mid-level providers and nurses. In fact, providers from every discipline and level of experience would benefit from this course. And this is from a physician who's practiced for over 30 years and found this course to be very helpful and beneficial. All medical providers and dentists should be required to take this course. And in my current job assisting IDD clients, I had no training or exposure to IDD Healthcare. This is a wonderfully condensed program full of valuable information. I'm not going to read the others, but I just wanted you to get an idea that clinicians who have practiced for years have found this course to be very helpful and very valuable to them. The course was also piloted at a medical school, and here's some information from a couple of medical students. I really liked the way the information was presented. The quality of information in this online course is one of the best that I've had. I thought the layout was very well organized. I like how it provided lists of questions and things to consider when dealing with IDD patients. There was good practical advice about things we could start asking immediately. And that's one of the goals of the course, is we wanted to provide information that was usable and immediately able to be implemented in someone's practice. The participants were asked to self-rate their ability to deliver effective healthcare prior to the course and then after taking the course. For practicing clinicians, they said that their ability, their confidence in providing healthcare for people with disabilities increased by over 62%. And for medical students, they showed a 107% increase in their self-rated ability to deliver healthcare for people with disabilities. So to summarize, the course is web-based. It's accessible from anywhere at any time. It includes continuing medical education credits for physicians and also CEUs for nurses. It's available to individual physicians, or if someone's interested in providing this training to a larger group, there are discounted rates. And it's also applicable for other disciplines, including nurses, PT, OT, dietitians, and others. So the second resource I wanted to talk with you about is the book called Clinical Pearls in IDD Healthcare. So it really is a primer in IDD Healthcare. It can be used to provide concise clinical information to healthcare providers but also to really anyone who works to support people with disabilities. This could include direct support professionals. It's great to use for in-service training for staff, to orient new staff members to some of the health issues in this field. And also for family members. It can be used to provide support and training and health information for family members and, of course, people with disabilities themselves. There are actually 55 pearls in the book that cover a variety of topics. Here's the table of contents. You can see that the clinical pearls are in 4 different categories. They're in general supports, medical supports, behavioral and psychological support, and nutritional support. So under general, you have things like, what is a residential agency? I mean, many people who work in this field or who are not aware of this field, in particular healthcare providers, don't understand what an agency is, what is a residential provider, and what do they do? It talks about communicating with people with disabilities, person-first language, person-centered thinking, quality of life, sexuality, abuse and neglect, which is such a common issue that people need to be aware of, end-of-life decision-making, aging with disabilities. Under medical supports, you can see things like the fatal 5, aspiration, seizures, constipation, a number of other issues, swallowing issues in people with disabilities, gastrostomy and jejunostomy tube considerations, just a little bit about those, anti-epileptic drugs, medication side effects that can cause behavioral issues, oral health care. Under the behavioral/psychological support section, you'll see listings of medical causes of adverse behaviors and dental causes as well. The importance of looking at the psychosocial aspect of behavior, looking at mental health conditions, key considerations when prescribing psychotropic drugs, dementia in people with IDD. And then in the final section under nutritional support, you'll see various things, including positioning for better functioning to help with swallowing and digestion and elimination, and the impact of active movement and positioning on bowel function. The book is formatted in a binder. Each of these clinical pearls is on its own cardstock with an aqueous coating for durability, and we give permission for these to be taken out and photocopied and provided, say, to a family member or for an in-service, or taken with the person to a clinician's visit to give them information as well. Here are a few examples. So here's the first one. What is a residential agency? Again, if you look on the left, it gives you a list of the team members, and this can help a clinician know who helps support this person, and if they need information, who they might be able to contact. Here's an example of medical causes for behaviors in people with intellectual and developmental disabilities. You can see they're listed into categories, and it lists behaviors that could point to these specific conditions. This one's about quality of life for people with IDD. And one of the first things it talks about is how people should not be placed under a DNR order or a do not resuscitate order simply because they have a disability. So you now know about 2 resources that are available that you can help provide to clinicians who support people with disabilities: the curriculum in IDD Healthcare and Clinical Pearls in IDD Healthcare. You recall earlier that I mentioned I would get back to the topic of being able to reach the target audience. Sometimes it can be hard to get information to healthcare providers, but who has access to these clinicians that are seeing patients with disabilities? Well, direct support professionals and other staff and family members who accompany people to clinician visits. So that's an avenue to make clinicians aware of these resources. Who has influence with physicians that see people with IDD? The answer is you do. You have relationships with these physicians, these clinicians that help provide healthcare to people that you support, you can guide them. You can offer these types of resources to them, make them available to them to help improve overall healthcare for the people that you support. You might consider providing a copy of the clinical pearls to the clinicians who see the people that you support, or even, as I mentioned, you can photocopy individual pearls to provide them with specific information on a specific topic as needed. You could also help provide them access to the curriculum. Just let them know that it's out there. Let them know how to access it. Tell them about hrstonline.com and how to access this course. You might also consider funding their access and providing this to them free of charge. This, is a great way to deliver pertinent information to clinicians who are seeing people with disabilities. It's easily digestible, it's highly relevant and immediately usable, and it can help improve outcomes. But it can also help build a positive relationship between the provider organizations and the clinicians. Remember, when we educate clinicians, we save lives. I really want to thank you today for taking the time to learn more about the curriculum in IDD Healthcare and the clinical pearls. Again, I'm Craig Escude. You can reach me at craig@hrstonline.com. I'm very happy to answer any questions that you may have on the course or the book or any other of our company's offerings. You can visit us at hrstonline.com. You'll find out more about both of these resources that are available. You can get a copy of the Clinical Pearls in our store, and you can also learn more about other offerings of the company, including the health risk screening tool. We have a couple of handouts that you can download that will give you a little bit of information as well too. They should be in the handout section. And if you have typed in any questions in the chat for the webinar, I will get those questions and I will respond to you as soon as I can. I also want to thank you personally for what you do to support people with disabilities. This is a difficult and challenging field to work in. It's also very rewarding, but I know that people who work in this field don't get thanked enough. So thank you personally for what you do. And again, I'd love to talk with you, so reach out whenever you can, and I will look forward to seeing you at an upcoming conference, hopefully. But let's chat sometime soon.